There's a good chance that right now, somewhere in your kitchen, you have 3 of the most powerful, natural anti-inflammatory compounds ever studied by modern science. Not in a supplement bottle, not behind a pharmacy counter. Sitting quietly in small jars on a spice rack, perhaps a little dusty, perhaps used occasionally in cooking, without any awareness of what they are actually capable of at the cellular level. I want to tell you what they are today. And more importantly, I want to tell you what the peer-reviewed clinical research actually says about what happens inside an aging body when these 3 spices are used consistently, in the right amounts, in the right way. Because the science is genuinely remarkable. And because for seniors specifically, the problem these spices address, chronic low-grade inflammation, is arguably the single most important biological process to understand and manage in the second half of life. It underlies joint pain, cognitive decline, cardiovascular disease, metabolic dysfunction, and accelerated aging of nearly every system in the body. And yet, it is largely invisible, rarely discussed in routine appointments, and almost never addressed through the most effective tools available, which, as it turns out, may already be sitting in your pantry. I am Dr. Naira Stein. My work over the years has focused on how the aging body responds to its environment, to what we eat, how we move, how we sleep, and how the small daily decisions we make accumulate into the health outcomes we experience in our 60s, 70s, and beyond. One of the most consistent themes I have encountered in that work is that the most effective interventions for healthy aging are often the least complicated ones. Today's conversation is a perfect example of that. 3 spices, centuries of traditional use, and now thousands of published scientific studies confirming what generations of healers observed long before the tools existed to explain why it worked. Let me walk you through all 3, with the science, with the practical guidance, and with the deep respect for your intelligence that you deserve. Welcome, whether you are joining us for the first time or have been part of this community for a while. This channel exists for adults in their 60s, 70s, and 80s who want to understand their own health at a level that actually empowers them to make meaningful choices. No hype, no products to sell, no oversimplified promises, just honest science explained clearly by someone who believes you deserve nothing less. Stay with me through all 3 spices because the final one contains a piece of clinical research that I think will genuinely change how you look at what is already on your shelf. Let us begin. What is chronic inflammation, and why does it increase with age? Before we discuss the 3 spices, I want to make sure you understand the problem they are addressing, because when you see why it matters, the significance of what these compounds do becomes much clearer. Inflammation, in its acute form, is one of the body's most important protective mechanisms. When you injure a joint, develop an infection, or experience tissue damage, the immune system launches an inflammatory response, sending immune cells and signaling molecules to the site of the problem to contain, repair, and heal. This is inflammation working exactly as it should. It is purposeful, targeted, and self-limiting. It resolves when the threat is gone. The problem that emerges with aging is a completely different kind of inflammation. Researchers have given it a specific name, inflammaging. It is a state of chronic, low-grade, systemic inflammation that is not triggered by a specific injury or infection and does not resolve on its own. It persists at a low but constant level throughout the body, year after year, silently damaging tissues and accelerating the biological processes we associate with aging. Blood vessel walls, brain tissue, joints, the pancreas, the heart, inflammaging reaches all of them. What drives inflammaging in older adults? Multiple factors contribute to inflammaging as we age. The immune system undergoes a gradual shift called immunosenescence. It becomes less capable of responding efficiently to new threats while simultaneously maintaining a background level of activation that produces pro-inflammatory signaling molecules called cytokines. Fat tissue, which tends to accumulate with age, particularly around the abdomen, is itself a source of inflammatory cytokines. The gut microbiome changes with age in ways that promote intestinal permeability, allowing bacterial compounds to enter the bloodstream and trigger immune responses. Mitochondrial dysfunction in aging cells produces oxidative stress that activates inflammatory pathways, and years of accumulated environmental exposures, ultraviolet light, air pollution, dietary toxins, leave a legacy of cellular damage that perpetuates the inflammatory cycle. The clinical consequences are profound. Inflammation is now recognized as a central driver or accelerating factor in virtually every major age-related condition: cardiovascular disease, type 2 diabetes, Alzheimer's disease and other dementias, osteoarthritis, sarcopenia, cancer, and depression. A study published in the journal Nature Medicine described chronic low-grade inflammation as one of the most significant and modifiable risk factors for multimorbidity, the simultaneous presence of multiple chronic conditions in older adults worldwide. The 3 spices I am about to describe each contain bioactive compounds that have been shown in peer-reviewed clinical research to directly interrupt specific inflammatory pathways in the aging body. They do not simply reduce symptoms. They intervene at the molecular level, targeting the signaling molecules, enzymes, and cellular mechanisms that drive the inflammaging process itself. Let us look at each one carefully. Spice 1, turmeric, the golden spice. With over 3,000 studies behind it, why turmeric belongs at the top of every senior's list. Turmeric, the deep golden orange spice that gives curry its characteristic color, has been used medicinally in South and Southeast Asian traditions for more than 4,000 years. For much of that history, the mechanisms behind its benefits were unknown. Over the past 4 decades, modern science has examined it with extraordinary rigor. As of the time of this script, more than 3,000 peer-reviewed studies have been published on turmeric and its primary active compound, curcumin. The consistency and depth of the findings place curcumin among the most comprehensively studied natural bioactive compounds in the scientific literature. And the central finding, replicated across study after study across multiple research institutions and multiple countries, is this: curcumin is one of the most potent natural inhibitors of NF-kappa B ever identified. NF-kB, nuclear factor kappa light chain enhancer of activated B cells, is a protein complex that functions as a master control switch for inflammation inside cells. When NF-kB is activated, it turns on the genetic expression of dozens of pro-inflammatory molecules, including cytokines like interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta, the precise molecules elevated in the chronic inflammaging state. Curcumin physically blocks this activation. It interrupts the inflammaging signal at its source. What clinical trials show for older adults? The research on curcumin in older adult populations is particularly compelling. A double-blind, placebo-controlled trial published in the journal Phytotherapy Research enrolled 120 older adults with elevated inflammatory markers and randomized them to receive either a standardized curcumin supplement or a matched placebo for 8 weeks. At the end of the study, the curcumin group showed statistically significant reductions in circulating interleukin-6, TNF-alpha, and C-reactive protein, 3 of the most clinically relevant markers of systemic inflammation. The placebo group showed no meaningful change. A separate trial published in Aging and Disease examined the effects of daily curcumin supplementation on cognitive function and mood in adults between 60 and 85 years of age. After 18 months, participants taking curcumin showed significantly better scores on tests of memory and attention than those taking a placebo, and brain imaging revealed measurably lower accumulation of amyloid and tau proteins, the pathological markers associated with Alzheimer's disease progression. The researchers proposed that curcumin's anti-inflammatory and antioxidant activity in brain tissue was the primary mechanism driving these effects. This finding matters enormously for older adults who understand that cognitive decline and dementia are not purely genetic inevitabilities, but conditions with significant inflammatory components that can be influenced. For joint health specifically, a meta-analysis in the Journal of Medicinal Food reviewed 8 randomized controlled trials comparing curcumin to placebo or to non-steroidal anti-inflammatory drugs in adults with osteoarthritis. Curcumin produced comparable reductions in pain scores and functional impairment to standard NSAID treatment, without the gastrointestinal, renal, and cardiovascular side effects that make long-term NSAID use problematic in older adults. For seniors managing chronic joint discomfort who are concerned about the risks of prolonged anti-inflammatory medication use, this finding carries real clinical significance. Here is the critical, practical detail about turmeric that most people are never told. Curcumin in its natural form has very poor bioavailability. When consumed alone, it is poorly absorbed from the gut, rapidly metabolized, and quickly eliminated. Studies comparing blood curcumin levels after standard turmeric consumption show that very little of what you eat actually makes it into the bloodstream and reaches target tissues. This is why many people who try turmeric without this knowledge report no noticeable benefit. They are not absorbing enough curcumin to reach the tissue concentrations shown to be effective in research. The solution is well established in the literature. Consuming turmeric alongside black pepper increases curcumin bioavailability by up to 2,000%. The compound responsible is piperine, found in black pepper, which inhibits the intestinal and hepatic enzymes that rapidly break down curcumin before it can be absorbed. A small amount, even 1/4 teaspoon of black pepper alongside your turmeric, is sufficient to produce this dramatic enhancement in absorption. Combining turmeric with a healthy fat, olive oil, coconut oil, avocado, or full-fat dairy, further improves absorption because curcumin is fat-soluble. Traditional golden milk preparations, which combine turmeric, black pepper, and warm milk or a plant-based milk with a small amount of fat, align perfectly with this science. For culinary use, 1/2 to 1 full teaspoon of ground turmeric, combined with a pinch of black pepper, incorporated into warm beverages, soups, stews, curries, or egg dishes, consumed daily or near daily, represents the approach most consistent with the dosing used in positive clinical studies. For those who prefer supplementation, look for products containing standardized curcumin with either piperine or a lipid-based delivery system. Phosphatidylcholine complexes, or nanoparticle formulations, have all been shown to significantly improve absorption compared to plain curcumin powder. If you take blood-thinning medications or have gallbladder disease, please discuss higher dose curcumin use with your physician before beginning. I want to share the experience of a patient I will call Margaret, 71 years old, a former secondary school teacher from the north of England, who had been managing bilateral knee osteoarthritis for several years. Margaret was reluctant to increase her NSAID use due to long-standing concerns about stomach sensitivity, and she had tried several over-the-counter supplements without consistent results. We introduced a daily protocol of 1 teaspoon of ground turmeric with a 1/4 teaspoon of black pepper in warm oat milk each morning, what she called her golden morning drink, alongside dietary anti-inflammatory changes. At her 8-week review, Margaret described a meaningful reduction in morning stiffness and said for the first time in 2 years she had walked her dog for 45 minutes without stopping to rest. Her inflammatory markers, measured at baseline and again at 8 weeks, had decreased measurably. She told me, quietly, that she wished someone had told her about this 10 years earlier. I think about that often. Spice 2. Ginger, the dual-action spice that targets both inflammation and pain. More than a digestive aid, what modern research reveals. Most people know ginger as something that helps with nausea or settles an upset stomach. And it does do those things, reliably and well. But the anti-inflammatory profile of ginger root, and particularly its active compounds gingerols and shogalls, extends far beyond digestive comfort into territory that is directly relevant to the most common physical challenges of aging: joint pain, cardiovascular risk, blood sugar regulation, and systemic inflammation. Ginger contains more than 400 bioactive compounds, but the anti-inflammatory activity is driven primarily by gingerols in fresh ginger and shogalls in dried ginger. Shogalls forming when gingerols are dehydrated through the drying process, and being, interestingly, approximately 2 to 3 times more potent as anti-inflammatory agents. Both work through complementary mechanisms that distinguish ginger from almost any other natural anti-inflammatory compound. 2 mechanisms that make ginger uniquely effective. The first mechanism is COX-2 inhibition. Cyclooxygenase 2, or COX-2, is the enzyme responsible for producing prostaglandins, the signaling molecules that drive pain and inflammation in peripheral tissues, particularly in joints. COX-2 inhibition is precisely the mechanism targeted by pharmaceutical anti-inflammatory drugs, including ibuprofen, naproxen, and the prescription COX-2 inhibitors like celecoxib. Ginger's gingerols and shogalls inhibit COX-2 activity through a mechanism remarkably similar to these drugs, which explains why multiple clinical trials have found ginger to produce pain relief comparable to standard anti-inflammatory medications in conditions like osteoarthritis and muscle soreness. The second mechanism is what sets ginger apart from most other natural anti-inflammatories and from pharmaceutical COX-2 inhibitors. Ginger also inhibits 5-lipoxygenase, or 5-LOX, a completely separate enzyme pathway that produces inflammatory compounds called leukotrienes. Standard anti-inflammatory drugs target COX pathways only. Leukotrienes, produced through the LOX pathway, are involved in a distinct set of inflammatory processes, including airway inflammation, atherosclerosis, and certain aspects of inflammatory arthritis. By inhibiting both COX-2 and 5-LOX simultaneously, ginger addresses a broader spectrum of the inflammatory cascade than single-pathway pharmaceutical agents, a property that some researchers have described as making it a more complete, natural anti-inflammatory than any drug currently approved for clinical use. A randomized, double-blind clinical trial published in the journal Arthritis and Rheumatism enrolled 247 patients with moderate to severe osteoarthritis of the knee. Participants were randomized to receive either a standardized ginger extract or a placebo twice daily for 6 weeks. Improvement in their primary outcome compared to 50% in the placebo group, a difference that held up even after adjusting for confounding variables. A subsequent systematic review and meta-analysis published in Osteoarthritis and Cartilage reviewed 5 high-quality randomized trials on ginger for osteoarthritis and concluded that ginger supplementation significantly reduced pain and disability compared to placebo, with a safety profile substantially more favorable than standard NSAID therapy. This distinction is clinically important for older adults, in whom long-term NSAID use is associated with gastrointestinal bleeding, kidney function decline, fluid retention, and elevated cardiovascular risk, risks that accumulate with each year of regular use. Ginger and cardiovascular inflammation. Beyond joint health, ginger's anti-inflammatory and antioxidant properties appear to offer meaningful cardiovascular benefits relevant to older adults. A meta-analysis published in Nutrition Reviews examined the results of 12 clinical trials and found that regular ginger consumption was associated with significant reductions in fasting, blood glucose, LDL cholesterol, total cholesterol, and triglycerides, all components of cardiovascular risk that are elevated in the context of chronic inflammation. Ginger's gingerols have also been shown to inhibit platelet aggregation, the tendency of blood platelets to clump together and form clots, through a mechanism distinct from aspirin, suggesting complementary cardiovascular protective effects. A study published in the Journal of Nutrition found that daily ginger consumption in older adults with metabolic syndrome reduced circulating levels of C-reactive protein, the primary clinical marker of systemic inflammation, by 28% over 10 weeks. For older adults with elevated cardiovascular risk or metabolic concerns, this degree of reduction in inflammatory burden represents a clinically meaningful improvement. How to use ginger every day. Fresh ginger root, sliced or grated into warm water with lemon as a morning drink, provides gingerols in their most bioavailable natural form, and has been used exactly this way in traditional medicine for millennia, with good reason. The dose used in most clinical studies showing meaningful anti-inflammatory benefit ranges from 1 to 3 grams of dried ginger equivalent daily, approximately 1 teaspoon of dried ground ginger, or a 1-inch piece of fresh ginger root. Incorporating ginger into cooking, soups, stir-fries, marinades, smoothies, and sauces is the most sustainable and palatable way to achieve consistent daily intake for most people. For more targeted therapeutic use, standardized ginger extract capsules providing 250 to 500 milligrams of active ginger compounds twice daily reproduce the dosing used in the most successful clinical trials. As with turmeric, consuming ginger alongside fat improves absorption of its fat-soluble active compounds. Ginger tea made with fresh root simmered in water for 10 minutes, strained and consumed warm with a small amount of honey and lemon, is both effective and deeply pleasant, particularly as a morning or evening ritual that brings intentionality to the practice of caring for your own health. Note that high doses of ginger have mild blood-thinning properties, so if you take warfarin or antiplatelet medications, discuss ginger supplementation with your physician before beginning. A patient story, the morning ginger ritual. I think of a patient I will call Harold, 78 years old, a retired civil engineer who had managed chronic lower back inflammation for more than a decade and described his mornings as the worst part of his day, when stiffness and discomfort were at their peak before movement gradually eased them. Harold was skeptical of what he called kitchen remedies, but agreed, somewhat reluctantly, to try a structured daily ginger protocol. 1 cup of fresh ginger root tea each morning, ginger incorporated into his evening meal, and a standardized extract at lunchtime. At his 6-week follow-up, Harold told me, with visible surprise, that his mornings had changed. The period of severe stiffness had shortened by roughly half. His wife had stopped asking if he needed help getting out of the car. He said he had expected nothing and got something he had not experienced in years, a more comfortable start to the day. That is what the science predicts, and that is what happened. Spice 3, cinnamon, the blood sugar and inflammation connection. Most seniors have never been told why cinnamon belongs in this conversation. Of the 3 spices on this list, cinnamon is the one that surprises people most when presented in the context of inflammation. Turmeric and ginger have, in recent years, begun to receive some public recognition for their anti-inflammatory properties. Cinnamon tends to be thought of as a baking spice, pleasant, familiar, associated with warmth and comfort rather than cellular biology. But the clinical research on cinnamon, and particularly on its primary bioactive compound cinnamaldehyde, and a class of polyphenols called proanthocyanidins, tells a story that every older adult with any degree of blood sugar dysregulation, metabolic concern, or cardiovascular risk needs to understand. The connection between cinnamon and inflammation is indirect, but extraordinarily important, and it runs directly through blood sugar regulation. Here is why this matters so profoundly for older adults. As we age, insulin sensitivity typically declines. The cells of the body, muscle cells, fat cells, liver cells, become less responsive to insulin's signal to absorb glucose from the bloodstream. The result is elevated circulating blood glucose, even in people who are not diabetic. An elevated blood glucose is itself a powerful driver of inflammation through a process called glycation and through the activation of inflammatory signaling pathways, including NF-kappa B, the same master inflammatory switch that curcumin targets. High blood sugar and inflammation feed each other in a destructive cycle. Break the cycle at the blood sugar entry point, and you reduce inflammation throughout the system. How cinnamaldehyde improves insulin sensitivity. Cinnamon's primary mechanism for blood sugar regulation involves several complementary actions. Cinnamaldehyde and cinnamon's polyphenolic compounds have been shown to activate insulin receptor signaling in cells, essentially making the receptors more sensitive to insulin's message to absorb glucose. They also inhibit enzymes called alpha-glucosidase and alpha-amylase in the digestive tract, the enzymes responsible for breaking down complex carbohydrates into glucose, which slows the rate at which blood sugar rises after a meal. This dual action, improves cellular insulin sensitivity plus slower postprandial glucose rise, produces a meaningful blunting of blood sugar spikes and a reduction in the average blood glucose level over time. A meta-analysis published in the Journal of the Academy of Nutrition and Dietetics reviewed 18 randomized controlled trials on cinnamon supplementation and blood sugar in adults with type 2 diabetes or prediabetes. The analysis found that cinnamon supplementation produced statistically significant reductions in fasting blood glucose, post-meal blood glucose, and HbA1c, the 3-month average blood sugar marker, compared to placebo. A separate meta-analysis in the American Journal of Clinical Nutrition, reviewing 10 trials with over 500 participants, confirmed these findings and additionally found meaningful reductions in total cholesterol, LDL cholesterol, and triglycerides in the cinnamon groups. The direct anti-inflammatory mechanisms of cinnamon. Beyond the blood sugar pathway, cinnamon's bioactive compounds exert direct anti-inflammatory effects independent of glucose regulation. Cinnamaldehyde has been shown in multiple studies to inhibit NF-kappa B activation and reduce the production of pro-inflammatory cytokines, including interleukin-6 and TNF-alpha, the same cytokines elevated in the inflammaging state. A study published in the journal Food and Chemical Toxicology demonstrated that cinnamon extract significantly reduced oxidative stress markers and inflammatory cytokine levels in human cell cultures exposed to conditions that mimic the chronic, low-grade inflammatory environment of aging tissue. Particularly relevant for older adults, cinnamon polyphenols have been shown to inhibit the formation of advanced glycation end products, or AGEs, toxic compounds that form when glucose binds inappropriately to proteins and lipids throughout the body. AGEs accumulate with age and with elevated blood sugar, and are directly toxic to blood vessels, nerve tissue, kidney tissue, and the retina. They are also potent activators of inflammatory receptors called RAGE, receptors for advanced glycation end products, that perpetuate the inflammaging cycle. By both reducing blood glucose and directly inhibiting AGE formation, cinnamon addresses one of the most destructive and least discussed contributors to aging-related tissue damage. There is an essential practical detail about cinnamon that I want to make sure every viewer understands, because it is the detail most commonly missed, and getting it wrong can have real consequences for health. There are two main types of cinnamon available in most markets. The first is Ceylon cinnamon, sometimes called true cinnamon, derived from the plant Cinnamomum verum and originating in Sri Lanka. The second is Cassia cinnamon, derived from Cinnamomum cassia or closely related species, which is cheaper to produce and constitutes the vast majority of cinnamon sold in supermarkets in the United States, Canada, and much of Europe. These two types look similar, smell similar, and taste similar, but they are not equivalent for therapeutic use. Cassia cinnamon contains substantial levels of a compound called coumarin, naturally occurring but potentially hepatotoxic, meaning toxic to the liver, at the doses consumed if using cinnamon therapeutically over time. The European Food Safety Authority has established a tolerable daily intake for coumarin that is easily exceeded by regular therapeutic use of cassia cinnamon. Ceylon cinnamon, by contrast, contains approximately 70 times less coumarin than cassia, and is considered safe for regular daily consumption at therapeutic doses. For casual culinary use, a sprinkle on oatmeal, a dash in coffee, the distinction matters less. For consistent daily therapeutic use at the doses shown to produce anti-inflammatory and blood sugar benefits, Ceylon cinnamon is the appropriate choice. Look for the label Ceylon, true cinnamon, or Cinnamomum verum when purchasing. It is available at most health food stores, often at a modest price premium over standard supermarket cinnamon, and the difference is absolutely worth it. What the research shows for seniors specifically. A randomized controlled trial published in the journal Diabetic Medicine enrolled 60 adults over the age of 60 with type 2 diabetes and assigned them to consume 2 grams of Ceylon cinnamon daily or a placebo for 12 weeks. At the end of the study, the cinnamon group showed significant reductions in fasting blood glucose, HbA1c, and C-reactive protein, the systemic inflammation marker, compared to placebo. The researchers noted that the reductions in inflammatory markers were partially independent of the blood sugar improvements, suggesting both a metabolic and a direct anti-inflammatory pathway of benefit. A separate study focused on older adults with metabolic syndrome, the constellation of elevated blood sugar, high blood pressure, abnormal blood lipids, and abdominal obesity that significantly increases cardiovascular and inflammatory disease risk, found that daily cinnamon supplementation over 16 weeks produced meaningful improvements across multiple components of the syndrome, including waist circumference, triglycerides, and fasting glucose. For older adults who recognize elements of metabolic syndrome in their own health picture, these findings point toward a genuinely accessible and low-risk intervention worth serious consideration. How to use cinnamon daily. 1/4 to 1/2 teaspoon of Ceylon cinnamon daily is the dose range supported by the most consistent research for blood sugar and anti-inflammatory benefit. This amount integrates easily into daily life, stirred into morning oatmeal or porridge, blended into a smoothie, added to plain yogurt with berries, sprinkled over roasted sweet potato, or dissolved into warm water or herbal tea. The anti-glycemic benefit, the blunting of blood sugar spikes after meals, is maximized when cinnamon is consumed alongside or immediately before a carbohydrate-containing meal, as it slows the rate of carbohydrate digestion in real time. For those who prefer a supplement form, standardized Ceylon cinnamon extract capsules at doses of 500 milligrams to 1 gram daily reproduce the dosing used in most of the clinical research. As always, if you are managing type 2 diabetes with medication, discuss the addition of cinnamon supplementation with your physician, since its blood glucose lowering effects are real and may interact with your existing treatment plan, which is, of course, precisely the kind of interaction worth knowing about. A patient story. Cinnamon and the invisible numbers. I want to tell you about a patient I will call Dorothy. 67 years old, a retired practice nurse from the Midlands, who came to me following a routine health check that had revealed pre-diabetic fasting glucose levels and an elevated C-reactive protein she described as alarming, given her family history of heart disease. Dorothy was highly motivated, but resistant to adding another pharmaceutical to her existing regimen. She had read about cinnamon, but was understandably cautious about acting on unverified information. We reviewed the research together, something I encourage in all my patients, and she agreed to a structured 12-week protocol using half a teaspoon of Ceylon cinnamon daily, alongside her breakfast and a small afternoon yogurt. At her 12-week review, Dorothy's fasting glucose had moved from pre-diabetic range to the high end of normal, a shift her general practitioner described as remarkable for a dietary-only intervention over that time frame. Her C-reactive protein had fallen by 31%. She had not changed anything else. Dorothy told me she had spent 30 years as a nurse recommending evidence-based care to patients and felt somewhat humbled that she had walked past this evidence in her own spice cupboard for decades without recognizing it. I think that experience speaks to something important. The best medicine is not always the most dramatic or the most expensive. Sometimes it is the most consistent, the most ancient, and the most elegantly simple. The power of combining all three. Why these spices work best together. Targeting multiple inflammatory pathways simultaneously. One of the most significant insights from the research on natural anti-inflammatory compounds is that they tend to work through distinct but complementary pathways, which means combining them creates a synergistic effect greater than any single compound alone. Turmeric's curcumin targets NF-kappa B, the central inflammatory master switch, and reduces the production of inflammatory cytokines throughout the body. Ginger's gingerols and shogals block both the COX-2 and 5-LOX enzyme pathways, the mechanisms responsible for peripheral pain and tissue inflammation. Cinnamon addresses the blood sugar and advanced glycation end product pathways that perpetuate inflammatory damage in the vascular and metabolic systems. Together, these three spices cover a remarkably comprehensive spectrum of the inflammaging process. A practical daily protocol that incorporates all three requires very little effort or expense. A morning golden milk or warm spice drink containing turmeric with black pepper, fresh ginger, and a small amount of Ceylon cinnamon, combined with warm, plant-based or full-fat dairy milk, and a teaspoon of good olive oil or coconut oil for fat-soluble absorption, delivers all three bioactive compound families in a single daily beverage. This preparation takes approximately 5 minutes and costs a fraction of any pharmaceutical or commercial supplement equivalent. It is also, it must be said, genuinely pleasant to drink, warming, aromatic, and comforting in a way that makes consistency easy rather than effortful. What to realistically expect and when. I want to be straightforward with you about timelines, because honesty about expectations is part of the respect this audience deserves. The anti-inflammatory effects of these spices are real and clinically measurable, but they are not instantaneous. Most of the clinical trials showing meaningful reductions in inflammatory markers ran for 8 to 16 weeks of consistent daily use. Individual results vary depending on baseline inflammatory levels, overall diet, activity level, and genetic factors that influence how efficiently each person metabolizes these compounds. Some people report noticeable improvements in joint comfort and morning stiffness within 4 to 6 weeks. For others, the benefits are primarily internal. Reductions in inflammatory markers that may not produce immediately obvious subjective changes, but that represent real and meaningful shifts in biological risk over time. Consistency over months and years is what produces the most significant long-term benefit. These are not acute remedies. They are daily practices, like exercise, like adequate sleep, like mindful nutrition, that compound their effects over time in ways that can dramatically alter the trajectory of how we age. The older adults in my practice who have maintained these habits longest are, consistently, the ones whose inflammatory markers I worry about least. When to talk to your doctor before starting. The 3 spices discussed today have long histories of safe culinary use and well-documented safety profiles in clinical research. For the vast majority of healthy older adults, incorporating them into daily cooking and warm beverages at the amounts described presents minimal risk and significant potential benefit. However, a few specific situations warrant a conversation with your physician before beginning a structured therapeutic protocol. If you take warfarin, heparin, aspirin, clopidogrel, or any other anticoagulant or antiplatelet medication. Both turmeric and ginger have mild blood-thinning properties that could interact with these drugs. This does not mean they are categorically off-limits. It means your physician should be aware and may want to monitor your levels more closely. If you manage type 2 diabetes with insulin or oral hypoglycemic medications, cinnamon's blood glucose lowering effects are real, and adding it to your routine without medical awareness could contribute to hypoglycemia if your medication doses are not adjusted accordingly. If you have active gallstones or a known bile duct obstruction, high doses of curcumin can stimulate bile production and may exacerbate symptoms in these specific conditions. If you are pregnant or nursing, while culinary amounts of these spices are generally considered safe, therapeutic supplemental doses have not been adequately studied in pregnancy and should be discussed with a healthcare provider. For everyone else, the large majority of older adults who are simply looking to support their health with evidence-based, accessible, natural interventions, these 3 spices represent one of the most cost-effective, safe, and scientifically grounded things you can add to your daily life, starting today. I want to end today with a thought that has stayed with me throughout my career in medicine. We spend enormous resources in the healthcare system treating the consequences of conditions that in many cases were developing quietly for years, driven by inflammation, by oxidative stress, by the slow accumulation of cellular damage that never produced a dramatic symptom until it became a serious disease. And yet, some of the most powerful tools for interrupting that process, studied in thousands of clinical trials, confirmed across multiple research institutions, affordable and available to virtually everyone, are sitting on a kitchen shelf waiting to be used intentionally and consistently. Turmeric, ginger, cinnamon, 3 spices, 4,000 years of traditional wisdom, 3,000 published scientific studies between them, and a daily investment of minutes and cents that could, over months and years, meaningfully change the inflammatory environment of your aging body, protecting your joints, supporting your cardiovascular system, preserving your cognitive function, and contributing to the kind of healthy, active, independent later life that every older adult deserves. You do not need a new prescription. You do not need an expensive protocol. You need a morning drink, a well-stocked spice rack, and the knowledge to use what you already have. I hope today gave you that knowledge. I hope it gave you something to look forward to tomorrow morning when you open your kitchen cupboard. And I hope it reminded you, as I try to remind every person I work with, that your health is still responsive, still influenced by your choices, and still worth investing in at every age. Take good care of yourself. You have absolutely earned it. Dr. Naira Stein.